Hi everyone, welcome back to my YouTube channel and today we are going to talk about lipoma. So let's start our topic with introduction. Lipoma is common benign tumor of adipose tissue that can occur anywhere in the body, including oral cavity, neck, trunk and extremities. Lipomas are usually soft, slow growing and painless and they are considered non-cancerous. While often asymptomatic, lipomas may cause discomfort or cosmetic concerns depending on the size and location. Definition of lipoma. Lipoma is defined as a benign encapsulated tumor composed of mature adipocytes. It is a soft tissue tumor that typically grows slowly and does not invade surrounding structures. Epidemiology of lipoma. Lipomas are most common benign soft tissue tumors in adults. Frequently, they occur in middle-aged people like 40 to 60 years of age. They have slight male predominance has been reported in case of lipomas. Common site for lipomas include trunk, neck, upper arms, thighs and oral cavity like buccal mucosa, tongue and lips. Etiology and risk factors of lipoma. The exact cause of lipoma is unknown, but several factors may contribute. They include genetic predisposition, as some familial forms of lipoma may exist. Second is trauma, that it may trigger local proliferation of adipose tissue. Third is obesity, as it has higher incidence of lipoma in overweight individuals. Fourth is metabolic factors, as altered fat metabolism may play a role in case of development of lipoma. Pathophysiology of lipoma. Lipoma arise from mature adipocytes that accumulate in a localized area. They are usually encapsulated, which distinguish them from diffuse fat accumulation. Lipomas grow slowly and push surrounding tissue rather than invading them. Histologically, lipomas may show mature fat cells in lobules, thin fibrous capsule, minimum vascularity. Variants of lipoma may include fibrolipoma, angiolipoma, spindle cell lipoma, and depending on additional tissue components. Clinical features of lipoma. First, we'll talk about its appearance. It appears as a soft, mobile, and well circumscribed subcutaneous nodule. It is usually painless unless compressing nerves or vessels. Skin over the lesion is normal in case of lipoma. It is slowly growing and often it grows over months to years. Size of lipoma. It is usually small, like 1 to 3 cm, but may grow larger in some cases. Common sites for lipoma include trunk, neck, shoulder, upper arms, and thighs. Oral cavity. In case of oral cavity, the common sites are buccal mucosa, tongue, floor of mouth, and lips. Symptoms of lipoma. They are mostly asymptomatic, but they may cause discomfort, cosmetic concern, or functional impairment if they are large. Diagnosis of lipoma. Diagnosis of lipoma is primarily clinical, that is confirmed by imaging or histopathology if needed. First we do is clinical evaluation. In clinical evaluation, we detect soft, mobile, painless nodule that is slowly enlarging mass and history of long-standing non-tender lesion is there. Talking about imaging, we can do ultrasound for homogeneous hyperechoic mass and we can do MRI for well-defined encapsulated lesion with fat signal characteristic. And then we do is histopathology for lipoma, in which we found out lobules of mature adipocytes, thin fibrous capsule and minimal cellular atypia is there. This distinguish lipoma from liposarcoma, that is minimal cellular atypia. And then we do is differential diagnosis for lipoma. That differential diagnosis may include epidermoid cyst, fibroma, neurofibroma, hemangioma and liposarcoma. We have to distinguish or differentiate lipoma from all of these for better diagnosis. Management of lipoma. First we do is observation. It is done in case of small asymptomatic lipomas that may not require treatment. Second we can do is surgical excision, and it is treatment of choice for symptomatic, growing or cosmetically concerning lesions. Third we can do is liposuction, and it is sometimes used for large or multiple lipomas. Recurrence is rare if completely excised. Complications of lipomas. If untreated, even they are benign, the kinase of if excision is incomplete can be happen, and compression of nerves or vessels can happen in case of large lipomas, and this may cause pain or numbness. 4. It can cause cosmetic concern for visible lesion. Prognosis of lipomas. Prognosis is as excellent as lipomas are benign and non-cancerous. There is low recurrent rate after complete excision, and they do not undergo malignant transformation in majority of the cases. Conclusion of this lecture video. Lipomas are benign, slow-growing tumors of adipose tissue that commonly occur in adults. They are usually asymptomatic, soft, and mobile, and are diagnosed based on clinical features, imaging, and histopathology. Management is primarily surgical excision for symptomatic or cosmetic reasons, with excellent prognosis and minimal risk of recurrence. Awareness of lipomas is important to differentiate them from malignant soft tissue tumors and provide appropriate care. And this was all about lipoma. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.